In the spirit of reconciliation, DHSV acknowledges the traditional custodians of the land that we are filming on and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Welcome to the DHSV Coffee Catch-Up series, where we shine a light on key oral health issues to spark discussions that lead to change. Today, we're looking at how we can ensure that oral health is prioritised in community health settings. At DHSV, we work with over 50 community dental services across Victoria to ensure the community has access to quality oral health care. But when we look at the broader health setting, oral health can often get lost in the mix. For too long, the mouth has been treated as separate to the rest of the body, despite good oral health being essential for overall health and well-being. So how do we put the mouth back in the body? How do we ensure that oral health is better integrated into general health so we can enhance patient-centred care? To discuss this important topic, I'm joined by Nicole Bartholomeusz, one of our esteemed board directors, and the CEO of cohealth, a not-for-profit community health organisation working with communities in Melbourne's CBD, northern and western suburbs. Nicole has worked extensively in public health and government in executive and non-executive roles for over 20 years. Nicole is passionate about community health and committed to the mission of improving health in partnership with individuals and the community. Social justice and health equity are the core principles of her decision-making and key drivers of her advocacy. She feels privileged to have led an organisation that has consistently delivered outstanding services for communities who experience disadvantage. With a clinical background, governance expertise and expertise in primary care and the acute sector, Nicole is uniquely positioned to understand the Australian health landscape, navigate change and lead system reform. Welcome, Nicole, and thanks for joining me. So it's great to see you. We're talking today about community health because that's where your world lives. Can you give us, how do we actually bring community health and oral health together in a better way?
Victoria is incredibly fortunate to have this amazing platform of community health. So the only state in Australia that has community health the way that we do. And it's a really unique opportunity to be able to use the strength of community health to be able to connect with community and ensure that community has access to the services that they need.
Yeah.
So we saw during COVID-19, the sort of height or the peak of the pandemic, the amazing work that community health did as a sector to really connect and engage with vulnerable and disadvantaged communities, ensure that those communities had access to the information that they needed to be able to stay well and stay safe.
Yeah.
And I think, there's lots that we've learnt from that time. There's lots that we've learnt about the way that community health works that we can apply to anything, whether it's oral health, whether it's diabetes. There's an amazing platform there that we can really use to connect people in with the services that they need.
So, Nicole, what are the key challenges that community health faces to improve the health outcomes, not necessarily just the oral health outcomes, but the health outcomes for the community? What does that look like in your space?
Yeah, I think there's always an issue of demand and supply.
Yeah.
And so being able to deliver the services that we know that community needs in a timely way is always a challenge.
Yeah.
With the particular communities that community health works with, obviously building that deep sense of trust and engagement is really important. So through the work of our oral health services, we've used a new workforce called Community Connectors. It's a workforce that was developed during COVID-19 to work with people in public housing to connect them into the services that they needed. We've been fortunate to be able to secure a little bit of funding to develop this workforce called a Community Connector. And that Community Connector is an individual that has been employed from community.
Right.
That we've developed and trained, and what they're doing is working with their local communities and working to connect those individuals and that community more broadly in with the services that we deliver at cohealth. So we've, during school holidays, been taking the Smile Squad van to the public housing estates.
Seen it on the telly.
Yeah, and had such a fantastic response from residents in those locations. But the Community Connector has played a really important role explaining the importance of oral health services, explaining how to access public oral health services in Victoria, but then also supporting the individual to come and have their teeth checked in the Smile Squad van, and then coming back to the clinic for any care, follow-up care that they might need. And we've had 0 people not attend those appointments because of that Community Connector person. So I think there's opportunities for those types of roles in community health, but those roles aren't funded. They're sort of funded for a short period of time. There's not ongoing funding, and so that impacts the way that we can deliver services.
And it is really that we've heard it a couple of times a lot of times in conversations. It's around that building of trust between the community and the health service, so that people actually feel safe to participate in whatever activities are happening, but also understand, like, lots of people don't do things because they don't know what the outcome's going to be, or is it going to cost me money, or am I going to be asked to do something I'm uncomfortable about? So, building that trust and rapport with the community, I think, is such an important part of, particularly in community health services, where you're smack bang in the middle of it all the time.
That's right. Yeah. That's right. It was, we did a survey of about 4,000 public high-rise residents just to understand their health and wellbeing needs, and more than half of people who responded to that survey weren't aware that they were eligible to access public oral health services, and had been living with dental pain for years, but not gone and had the pain attended to because of cost and language barriers and other barriers. So it was, we certainly learnt a lot about the communities that we work with during that COVID time, and the needs, the community's needs, and how we can better respond to those needs.
Because community health has a variety of services, general practice and allied health services and oral health services and those sorts of things. What strategies do you and the team use to make sure that the person's at the centre when we wrap everything around them? Is there some lessons that you've learned in particularly during COVID, because that became even more important, that we can take forward to other parts of health?
At cohealth, and I'm sure not dissimilar to other community health organisations, but we use a model of care which is to wrap services around the individual, so holistic, place-based, wrap-around service model. And oral health is a really great example of how that works. So the majority of new people, new patients, new clients coming into cohealth come through our oral health services.
Okay.
So we have a number of people who wouldn't ordinarily access health services until they're in pain, and usually it's dental pain.
Right.
And so they access our oral health service, and our oral health clinicians are actually trained to screen for broader health issues. So recognising that it's opportunistic, someone's attending to pain, and obviously we respond to their that oral health need.
So how do the team then work with that person to build that whole of system approach around them?
So it's so our oral health clinicians are trained to be able to ask questions and screen for other conditions or health issues or concerns that the individual might have, and then refer the individual to other cohealth services, or if there's services that are required that cohealth doesn't provide, to refer externally. So our oral health clinicians very much take a whole of person perspective and not just look at the mouth or the presenting problem, but are able to ask questions more generally and identify other needs that might need to be addressed, and so then are able to provide that warm referral into other services. So we find that that has been incredibly important with connecting people to other care, and such an important first contact for the individual as well. And all of our services at cohealth are delivered in a culturally sensitive, trauma-informed way, and are able to immediately sort of build that trust and engagement with the individual, and so they feel able to access other services as well. Yeah.
Was that a specific training program that you put people through? Because I know that, the clinicians that that I talk to, when we talk about identifying people who might have mental health issues, or identifying people who might have some form of domestic violence situation, they get very nervous about asking those questions. So have you built a whole program around training oral health practitioners to actually look at the whole person more broadly?
Yeah, it is part of our orientation program at cohealth. So it could be another service or another health provider asking people about their oral health, and the referral works the other way as well. So we see the importance of being able to integrate both physical and mental health services at cohealth, and there being no wrong door. So it doesn't matter what service you're walking into at cohealth, we're always looking at what are the needs of you as a whole person, and how can we wrap our services around you.
Fantastic.
But it's an ongoing conversation, isn't it? Because some of those questions are really hard for people to ask, or really challenging. Yeah,
absolutely. And I think it's how do we build skills and capacity of our clinical teams, because it's not just in oral health, it's in all of health now. People are, I don't know whether people are more complex than they've been in the past, but there's certainly so many more, moving parts that people need to be aware of as we're working through someone's health issues to try and get the outcome that's important to them.
That's right. And we know, for instance, that people who experience poor mental health often have their physical health needs discounted or overlooked.
Sure.
And or often, those physical health issues are associated with their mental illness, and so there's sometimes not proper attention, and people with a mental illness can go to 6 or 7 GPs before they find the GP that will actually focus on the physical health issues. So it's been a big part of cohealth's sort of philosophy for a long time, about looking at the whole person and being able to integrate all parts of the system.
What do you think are the challenges for community to understand that philosophy and understand where they can actually get the most appropriate care? I mean, we've been talking about shared decision making and co-design of people's care pathways. How do we actually build communities' capability to do that? Because actually we not only need the skill of the clinician, we actually need the skill of the community to actually step into that space as well.
Yeah, absolutely. Look, I think it comes to generating or creating that sense of awareness amongst communities. So health literacy is so important, and we really need to be starting early with schools and secondary schools around talking about health literacy and what does health literacy mean, and what does it look like, and what your role is in your own health care. So I think creating that, it's almost like a campaign, but almost that community awareness is really important. As an organisation, we could do a lot of work in terms of promoting the services that we have on offer, but doing so means that we would generate so much demand that we're not able to meet in terms of our capacity to supply services. So, but I think absolutely it is about creating that awareness around health literacy and people being aware of the services that are available to them, but also the importance of their role in their own health and well-being.
What do you think the levers are that not just health services but government can pull to actually improve access to healthcare. You know, how do we shift the system? You know, it's currently not working for a lot of people. What does that look like into the future, do you think?
It's a really big question.
How long's a piece of string? It is a really big question.
Look, I think there's a lot of work that we can do around our primary care services, and I think, you know, again, coming back to what I was saying earlier about Victoria being in a very unique position, having a community health model, it's definitely something that as a state we can continue to build and invest in. And I think, you know, I often talk about value-based healthcare, and we talk about value-based healthcare from the perspective of a clinician working to their top of scope of practice. But what about if we had a part of the health system that was working to its top of scope of practice to allow other parts of the system to work to its top of scope of practice? And so I think there's enormous opportunity there. Using the community health model to think about how community health is the sort of interface between the acute sector and primary care, and really being able to deliver services for vulnerable and marginalised communities. But I think as a country, as a nation, it would be incredibly amazing to see community health, the community health model, as a national primary health care model.
Yeah, it's interesting, you know, I think that the country is looking at health and going, this is not working for us. I think that people who are running health systems are going, this is not working. I'm thinking government's looking at it going, there's got to be a better way to do it. So I think we are primed to be able to have some of those tough conversations around, so how do we shift the system? And you know, my philosophy is figure out what it is that you need to do and then worry about how we're going to fund it later. Because if you think about it, oh, well, we can't do it because we don't have this bucket of money and the bucket's over there and somebody else is doing things, I think we'll never make a difference. So yeah. And
we have this unique opportunity at the moment in Victoria. So we have a Victorian Department of Health who has a vision for Victoria's population being the healthiest population in the world, which is incredibly inspiring. So I think we have this real opportunity to pivot or to change or to, you know, rebuild the health system in a way that really focuses on that sort of early prevention and early intervention services, that we're actually working with individuals and community, helping them to stay well at home, in community, preventing those hospital presentations.
And it's not even just the hospital presentations, but preventing GP presentations that aren't necessary. You know, we have really finite resources in those high-end spaces, and it's how do we actually support community to be more healthy? And that can't just be health doing that. You know, you need housing and financial security and employment and all of those other things that impact on people's health. But I think, you know, the conversation needs to start, and how we can make a difference going forward.
Absolutely. And if you think about, you know, the health outcomes, 80% of a person's health outcomes are determined by things other than their interaction with the health service. So it's, you know, it's the postcode that they live in, it's their access to housing, it's their income status, it's their education and training. So if we're actually able to influence all of those social determinants, we would actually, people would actually have much better health outcomes. Yeah,
completely. So we'll just get the fairy dust out and wave the magic wand and see if we can actually make that happen, because I think unless we do something quite radical in this country, we're going to run out of money, for one thing, but also not get great outcomes for our community, which is why we're all here.
That's right. That's right. Our, you know, our community, unfortunately, is getting sicker. You know, we see rising rates of chronic disease. We're seeing rising rates of mental illness. And so we need to be much more focused around the sort of prevention and early intervention work.
Completely. Totally agree. Thank you, Nicole. It's been great to catch up with you this morning. Thanks for taking the time, and I look forward to seeing how DHSV and cohealth can continue our great partnership moving forward.
Thanks, Sue. It's been great to be here with you this morning.